Your job is important. As a CNA, you provide the most direct patient care in long-term care facilities. You essentially are the eyes, ears, and hands of a facility. As the primary provider of direct patient care, you, whether you realize it or not, serve as the representative for your facility. You're conveying the values, ethics, and professionalism of both the facility that employs you and the field at large. So let's talk a little bit more about professionalism. In this presentation, we are going to think about professionalism in a much deeper way than you may have ever previously thought about it. Sure, you may have heard professionalism discussed in terms of showing up to work on time, adhering to a dress code, and so on. Yes, those behaviors matter. But we challenge you to think deeper about why professionalism matters and how it is related to your profession, your individual values, and your future career aspirations. Let us begin with a definition. Epstein and Hundert defined professionalism as professional competence is the habitual and judicious use of communication, knowledge, technical skills, clinical reasoning, emotions, values, and reflection in daily practice of the benefit of the individual and community being served. This is a lofty definition, is it not? But that is a good thing. The first section of this definition, habitual and judicious, this implies that professionalism should be both habitual or automatic, but also judicious or needing good judgment. In other words, professionalism should be ingrained in the daily activities of your job, those activities that are habitual and require little thought, but also professionalism requires thought and judgment. How you handle unexpected or adverse events requires good judgment and critical thinking. The middle of this definition cites the use of communication, knowledge, technical skills, clinical reasoning, emotions, values, and reflection. This implies that professionalism is much more than behavior. It is the very fabric of how you convey, think about, carry out, and reflect on your profession. At the root of the word professionalism is a profession. CNAs are bound together by a shared commitment to heal. Now, your profession is regulated by a number of sources: medical boards, hospital or facility committees, peer review, and your profession's code of ethics. Professionalism should be rooted in a profession's values. Values as a CNA are wide and varied, but with the overarching principle that these values result in providing better health care. It is difficult to observe and measure values, but professional behavior is one way to translate these values into an actionable code of conduct. This table highlights a few ways to demonstrate professional behavior in a medical environment. This list is certainly not exhaustive. There are many ways to demonstrate professionalism beyond what is listed here. But what we would like you to think about is how each professional behavior might map onto your professional values. Take a moment and review this list and consider your own professional conduct. Are there actions you need to work on? Are there professional behaviors you exhibit or hope to exhibit that are not listed in this table? You can pause this video and take a moment and jot down areas that you think you excel in and areas you think you can work on. Professionalism and leadership go hand in hand. As you develop your professional behaviors, you are likely to find yourself better suited for leadership opportunities. Leadership in your workplace may take on a variety of forms. There is informal leadership, where you may not necessarily have a designated job title indicating a leadership position, but you take on extra roles, responsibilities, or spearhead an initiative that improves patient outcomes, workplace culture, or professional growth. In fact, research suggests that healthcare employees often report taking on informal leadership roles prior to promotion or a shift in their careers. Informal leadership is often a stepping stone to your next career aspirations and establishing yourself as a valued employee in the workplace. So if leadership is something you feel drawn to, you might relate your motivation to one or both of two paths. One path is a path of ideals. This path is for those individuals that pursue leadership based on a set of ideals or values, those same ideals and values we just discussed in earlier slides about professionalism. Folks who identify with this path seek leadership skills from education and knowledge. Their goals are to develop gold standard nursing care or to help build a dream unit. These individuals tend to learn from others' leadership examples, making note of good and bad leadership skills based on experience. Another source of motivation is a career advancement path. These individuals actively seek leadership. They have directed interests and ambitions. Persons who identify with this path seek leadership skills through education, personal development, and directly apply leadership models taught to them from other leaders. Their ultimate goal is to play an impactful role in decision-making. Keep in mind, these paths are not mutually exclusive. Perhaps you identify with both of these possible active paths to leadership. Either way, your ideals, values, and professional behavior will play a role in finding the right path for you. In fact, a systematic review published in the Journal of Nursing Management showed significant associations between positive leadership behaviors, styles, or practices and increased patient satisfaction and reduced adverse events. That's right, by taking on leadership roles in your facility, either formally or informally, you can actually impact the health of your patients. Placing an emphasis on developing skills related to communication openness, participation in decision-making, and developing relationships oriented toward leadership has a positive association on adverse events in nursing home residents. Anderson et al., 2003. So how do you build upon and refine your leadership aspirations and goals? Well, there are a number of ways to do so. You can take on and practice leadership styles, skills, and roles. You can role model traits and characteristics of individual leaders you admire. You can pursue education and engage in leadership development programs. An important component of building your leadership skill set is to communicate your aspirations with your supervisors and team. Remember that leadership is positively associated with patient outcomes. Your desire to build on your skill set not only benefits you, but also your patients and workplace. In short, as you consider your professional growth, professionalism and leadership matters. In other words, professional behaviors open doors for personal career growth and potential for leadership development. But just as importantly, professionalism is an important component of the CNA field. Not only do you need to make good medical decisions based on evidence, but you also need to deliver that care in a way that is professional and best for your patient. To incorporate professionalism and leadership into your daily activities, remember, professional competence is the habitual and judicious use of professional skills. These skills grow with training, experience, and practice.